stay positive because beauty comes from the inside out, said Jean Proske. So here I am, A. Sagaya Arockia, presenting as a research scholar, Sri Venkateswara University, presenting my article under the guidance of Dr. Geeta Chaudhary. The title of my study is Effectiveness of Nurse-Led Interventions Program and Body Image Perception Among Nursing Students. So the article outlines are as follows: the introduction, need for the study, objectives, research methodology, results, discussions, conclusions, and references. So this why it is something like this?
Next.
Okay. So moving on to the introduction, adolescent is the phase of life between childhood and adulthood. It is a unique stage of human development and an important time for laying the foundations for a good health. As an individual level, adolescents experience various physical and social changes. A particular concern during this period is the idealization of a thin body shape, which can significantly affect the body image, psychological health, self-esteem, and overall well-being. Awareness programs are needed that addresses not only the developmental factors, but also the social and cultural influences that contribute to weight-related issues and their serious consequences on health. So moving on to the need for the study, the body image is a vital part of adolescent development. Studies stated that the negative body image affects many aspects of adolescent health. So overall health outcome seems to be better in adolescents with a positive body image, and positive body image has a significant influence on physical and mental health of the individuals. There are various ways to promote a positive body image, and it can be taught in schools, communities, healthcare settings, and in the society. As a healthcare professional, the positive body image can be taught to the adolescents to focus on functionality rather than the physical appearances and weight, and how to use social media intelligently to avoid the harm of comparisons. Hence, the study was taken by the researchers to promote a positive body image among the adolescents. The objectives of my study to evaluate the effectiveness of a nurse-led intervention program and body image perception within experimental group and control group. The second objective is to evaluate the effectiveness of nurse-led intervention program and body image perception between experimental group and control group. The hypothesis as follows: there will be a significant difference in body image perception within experimental group and control group, and there will be a significant difference in body image perception between experimental group and control group. Moving on to the research methodology, the research approach that I have taken is a quantitative research approach. The research design is a true experimental pre-test post-test design, that's a repeated measures design. The sample size that I have taken is a 130. The sampling technique that I used is a probability multi-stage sampling technique. The research setting is a selected nursing colleges at Uttara Kannada. The ethical clearance was obtained from the institutions where I have taken the samples. So the method of data collection, so out of 130 samples, I have taken 65 for a control experimental group and 65 for a control group using the probability multi-stage sampling technique. So I have done the pre-test was conducted and the nurse-led interventions was administered to the students in time interval. And then the post-test was done at the 4th week, 12th week, and 20th week. But whereas in control group, I have done a pre-test conducted, and only I have done the assessment at the 4th week and 12th week and 20th week. So moving on to the results, the table 1 represents the mean, standard deviation, t-value, and p-value to compare the body image perception scores within the experimental group and control group. So moving on to the pre-test mean, that is 47.22, and the SD was 10.75. The post-test one, it was 62.68, and the standard deviation was 8.27. The t-value is 12.079, and the p-value is 0.001. So which indicates there is a significant difference in pre-test and post-test in the body image score. So moving on to the pre-test 1 and the post-test 1. Once again, the t value is 16.5.4504 and the p value is 0.001, which once again indicates there is a significant difference in the body image score among the pre-test and the post-test 2. Moving on to pre-test 1, pre-test and the post-test 3, the t value is 16.969 and the p value is 0.001. Once again, which indicates there is a significant difference in the body image between pre-test and post-test 3. So also pre-test 1 and pre-test 2, there is a significant difference, and then pre-test 1 and pre-test 2, there is a significant difference. And only in pre-test 2 and pre-test 3, I didn't find any significant differences. While moving on to the control group, the pre-test mean was 47.2 and the standard deviation was 8.4. And the pre-test 1 was 49.91 and the standard deviation 11.52. The t-value was 1.839 and the p-value was 0.071. It was not significant. There is no significant differences in the body image score between the control group among the pre-test and the post-test 1. So also pre-test 1 and the post-test 2, there is no significant difference in the control group. There is pre-test 1, pre-test and the post-test 3 also. In pre-test 3, there is a significant difference. That is the t-value is 2.307 and the p-value is 0.024. Moving on to pre-test 1 and pre-test 2, there was a significant difference. Moving on to pre-test 2, post-test 2 and post-test 1, post-test 1 and post-test 3, there is no significant differences. And post-test 2 and post-test 3 also there is a significant differences as the t-value is 3.946 and the p-value is 0.001. Moving on to the next table, that is a table 2, mean, standard deviation, t-value and p-value to compare the body image perception score between experimental group and the control group. So here, in experimental group, the pre-test mean was 47.22 and the standard deviation was 10.75. In control group, it was 4.72 and the standard deviation was 8.4. So t-value is 0.009 and the p-value is 0.993, which indicates there is no significant difference between the experimental group and the control group. Coming to the post-test 1, in the experimental group, the mean was 62.68 and the standard deviation was 8.27. Whereas in control group, it is 49.91 and the standard deviation was 11.52. The t-value represents 7.257 and the p-value is 0.001. There is a significant differences between the pre-test 1 between experimental group and the control group. So also in experimental group post-test 2, there is a significant differences, and then also the post-test 3 between the control group and the experimental group, there is a significant differences. Moving on to table 3, represents mean, standard deviation, and p-value to assess the overall time effect and interaction effect on body image perception scores between experimental and control group. So this table depicts, as we know, the pre-test mean score is once again 47.22 and the standard deviation was 10.75. So this entire table depicts that the time effect in the body image score over time in both the group is significant, since the F value is 137.43 and the P value is 0.001. In the interaction effect between time and group is statistically significant, since the F value is 92.26 and the P value is 0.001. So it indicates that the body image score among experimental group over time is significantly greater as compared to the control group. So coming to a discussion, the study results indicated that there was a statistically significant difference in pre and post-test 1, 2, and 3 body image score within and between the groups, since p-value was 0.001. The time effect in the body image score over time in both the groups since p-value was 0.001. So the interaction effect between time and group was statistically significant since p-value was 0.001. So here the Sangat Borgen conducted a study to assess the effectiveness of a health body image interaction and positive embodiment among high school students. So among the total 2,446 12th grade boys and girls from 30 high schools selected using a cluster sampling technique. Data was collected at baseline, post-intervention 3 and 12-month follow-up. Result revealed that there was a statistically significant difference in post-test 1 and follow-up 2 scores between experimental and control group in girls since the p-value was 0.001. So coming to a conclusion, adolescent is an important period of psychosocial development where developing body image is a critical part and awareness is essential to understand this concept. So present study made an effort to make awareness and positive body image perception among the nursing students, and students achieved improvement in positive body image perceptions. So this is my reference for your look. So I thank you all for listening.